Welcome to section 4 of genetics. In this section, we'll be discussing pedigrees. Let's get started. Modes of inheritance are often studied by using pedigrees. A pedigree is simply a diagram representing the occurrence of an inherited trait from one generation to the next. In a pedigree, there are colored boxes and white boxes. Unaffected individuals are represented by white boxes, and affected individuals are represented by colored boxes. Let's pull up a figure so you can see what I'm talking about. This is a figure of several pedigrees showing the various modes of inheritance. It can be found in section 4 of genetics. Notice that the colored boxes, which you can see right here, for example, represent affected individuals, and the white boxes represent unaffected individuals. Squares represent males, and circles represent females. A horizontal line between two boxes, for example, right here, indicates a marriage or partnership between two individuals. Children are represented by a vertical line below a partnership. So, for example, this line right here. If a box is crossed out, like this, for example, then this means the individual is deceased. Finally, sometimes you may see Roman numerals written off to the side like this. You may also see numbers written next to each individual like this. These represent each generation and the individuals in each generation, and they can be used on questions to help you easily identify what the question is talking about. Okay, with this in mind, let's discuss the various modes of inheritance. Let's begin by discussing pedigrees for autosomal dominant conditions. In most of the pedigrees that you'll see on exams, there will only be two alleles for one gene. So, for example, big A, little a. The letter A represents the gene, and the capital and lowercase letters represent the two alleles of the gene. In an autosomal dominant pedigree, all individuals that are represented by a colored box will have at least one big A allele. So, as you can see from the figure, this person's genotype must be either big A, or big A, little a. All individuals who are homozygous for the recessive allele, so little a, will not be affected and will therefore not be represented by a colored box. So, for example, this person right here. Notice from the pedigree that an autosomal dominant mode of inheritance tends to affect both males and females in each generation. A unique finding from an autosomal dominant pedigree that distinguishes it from all others is male-to-male transmission, which you can see right here. Sometimes an X-linked dominant pedigree can appear similar, but in an X-linked dominant mode of inheritance, there is no male-to-male transmission. We'll talk more about this in a second. Okay, let's do a question. Based on the pedigree below, what can most likely be concluded about the genotype of 1-1? Okay, as we just discussed, pedigrees that affect both males and females in each generation tend to represent an autosomal dominant mode of inheritance. We can be sure that this is an autosomal dominant mode of inheritance because there is male-to-male transmission right here. So with this information in mind, we're asked what can most likely be concluded about the genotype of this individual right here. In order to answer this, it may be helpful to briefly review Punnett squares. This is a figure showing an autosomal dominant pedigree with Punnett squares, which can be found in section 4 of genetics. In autosomal dominant modes of inheritance, there are two common genotype possibilities, which are each represented by the Punnett squares. At the top of the squares, we can see the possible genotypes of the father, and to the left, we can see the possible genotypes of the mother. Also notice that the red letters represent individuals who will express the trait. In this pedigree, we can deduce that the father, shown right here, must be homozygous for the recessive allele because he does not express the trait. Now, what could the possible genotype of the mother be that is shown right here? Initially, you may think that her genotype could be either big A, or big A, little a. Either of these genotypes would result in expression of the trait because this is an autosomal dominant condition. However, if we look closely at the pedigree and the two Punnett squares, we can differentiate the two possibilities. If we look at the left Punnett square, we can see that this represents a mother who is homozygous for the dominant trait, so big A. If we look at the genotype possibilities of her offspring, we can see that all of the boxes contain big A, little a. In other words, in this example, all of the offspring would express the trait. Notice in the pedigree, however, that one of the 4 children does not express the trait. Therefore, we can conclude that this child must be little a. Notice that in this particular Punnett square, little a is not a possibility. Therefore, this must not be the correct genotype. If we look at the right Punnett square, we can see that this represents a mother who is heterozygous for the dominant trait, so big A, little a. If we look at the genotype possibilities of her offspring, we get big A, little a, and little a. This combination accounts for both the children who express the trait and the child that does not express the trait. So in answer to the question, the genotype of this individual must be big A, little a. In summary, anytime you're given a pedigree, it can be helpful to take a step back, draw out a Punnett square, and visualize the possibilities. Okay, with this in mind, let's continue discussing the other modes of inheritance. This is a figure showing an autosomal recessive pedigree, which can be found in section 4 of genetics. In an autosomal recessive pedigree, the affected individuals will have the genotype a. Conversely, the unaffected individuals can either be big A or big A. Individuals who are big A are heterozygotes and are called carriers. Notice from the pedigree that an autosomal recessive mode of inheritance tends to skip generations. Based on the affected individual, what can we conclude about the genotypes of her parents? Well, because she is AA, we can conclude that her parents must both be big A. If one of her parents were big A, then none of their offspring would express that trait. Conversely, if one of her parents were a, then that parent would also express the trait, which would be indicated in the pedigree. Therefore, we can conclude that both of her parents must be carriers for the trait. This is a figure showing an X-linked recessive pedigree, which can be found in section 4 of genetics. In an X-linked recessive pedigree, males are generally the only ones affected and there is no male-to-male transmission. So notice from the pedigree that only males are affected. We can assume then that both mothers of these men must have been carriers. This can be a little difficult to visualize, so it's helpful to look at the Punnett squares. The Punnett square on the left represents an affected father. Notice that the disease is denoted by the letter D by the X chromosome. This results in female offspring who are carriers, but nobody will express the phenotype. The Punnett square on the right shows an affected mother. Notice that in this example, 50% of the sons will be affected and will express the phenotype. This is the genetic combination that resulted in the pedigree we can see in this figure, and also how it will usually show up on step 1. So again, only males are affected, and we can assume that the mother must have been a carrier because there is no male-to-male transmission. In very rare circumstances, there may be other possibilities, which I'll draw now. Notice that in these examples, both males and females could be affected. I've indicated those who would be affected by the yellow markings. However, it's very unlikely for these unique circumstances to show up on step 1, so this was not included in the overview figure. It's most high yield to focus on the overview figure, keeping this Punnett square in mind. Aside from these very rare combinations, there is another way females may develop the disease, which is through something called skewed lionization. This can occur when one of the X chromosomes becomes condensed into heterochromatin and is silenced. This is a normal process that occurs in females and results in the formation of a bar body, which can be seen in cells. So for example, let's say a female has the genotype XXD. Normally, the normal X masks the recessive trait. However, if this X becomes silenced, then the recessive trait can manifest itself, resulting in the development of the trait or disease. Okay, moving on. This is a figure showing an X-linked dominant pedigree, which can be found in section 4 of genetics. Notice from the pedigree that both males and females are affected. This can sometimes be easily confused with an autosomal dominant pedigree, so you have to pay very close attention here. Recall that in autosomal dominant pedigrees, there is male-to-male transmission. In an X-linked dominant pedigree, however, there is no male-to-male transmission. So notice that this final generation shown right here is suggestive of an X-linked dominant mode of inheritance. The father is affected, but none of his 4 sons are affected. Also, from the first to second generation, we can see that the father passed the trait on to his 2 daughters, but not his son. So again, there is no male-to-male transmission. From the Punnett squares, we can see the 2 most common combinations. If the mother is affected, notice that she will pass the trait on to both daughters 50% of the time and sons 50% of the time. However, if the father is affected, 100% of the daughters will be affected and none of the sons will be affected. Just like with an X-linked recessive mode of inheritance, there are other possibilities that could be represented by a Punnett square. However, these are rare and unlikely to show up on step 1. This is a figure showing a pedigree of mitochondrial inheritance, which can be found in section 4 of genetics. Because mitochondria have their own DNA, mitochondrial diseases are a bit unique. Notice from the figure that the trait is only transmitted through the mother. So if we look at this portion of the pedigree, for example, we can see that this male did not pass the disease on to any of his children. However, if we look at this part, we can see that this mother passed the disease on to all of her children. So why are mitochondrial traits only passed on through the mother? This is because the mitochondria in sperm do not enter the ovum during fertilization. Therefore, only mitochondria from the mother are transmitted to the baby. For step 1, you need to know that mitochondrial diseases exhibit heteroplasmy. We discussed this in detail in section 1. You should also know that mitochondrial diseases result in muscle damage. This makes sense, right? Skeletal muscle tissue has a lot of mitochondria, so skeletal muscle tissue is usually affected in patients who have a mitochondrial disease. You should also know that a muscle biopsy will usually reveal ragged-appearing muscle fibers, regardless of the type of mitochondrial disease. Okay, let's do a question. A 25-year-old male is brought to the physician for a routine visit. He has a genetic condition affecting multiple family members. The pedigree is shown below. The patient is shown at 3-5. Based on these findings, what can most likely be concluded about this man's condition? A. He has a fibroblast growth factor receptor 3 mutation. B. His colon is covered with adenomatous polyps. C. He has autism, large ears, and macroorchidism. Or D. He has muscle weakness caused by a frame shift mutation. From the pedigree, we can see that this is either an autosomal dominant or X-linked dominant condition because multiple generations are affected and both males and females have the disease. Recall that in an autosomal dominant condition, there will be male-to-male transmission. In this pedigree, we see no male-to-male transmission, which is made clear by looking at the offspring of the men right here and here. Therefore, this pedigree represents an X-linked dominant condition. Now we need to figure out which answer choice represents an X-linked dominant condition. A is referring to achondroplasia, which is an autosomal dominant disease. B is suggestive of familial adenomatous polyposis, which is also an autosomal dominant condition. C is describing physical exam findings present in Fragile X syndrome. Fragile X syndrome is an X-linked dominant condition, so C is the correct answer. D is alluding to Duchenne muscular dystrophy, which is an X-linked recessive condition. So again, the answer is C.